I want to thank everybody for being here today. Some of you heard by now, earlier today, we had our first death related to the COVID-19 that was in Boone County today. Also give you just a little update. We've had a total now of 24 positive across the state of Missouri. The little update on the testing capacities that we're doing right now. You're going to see some mobile units being out there that we're going to put out across the state. There's one that went up today. You'll see in the near future more of those going up. out there today. The Guard, General Compton's here today, are on standby to assist in any of those testing facilities. And that's basically, I want to be clear on that, what their job would be is to help support the local levels as far as equipment goes, or manpower would go to set up temporary testing sites. On the PPE equipment that we've got in, that'll be being distributed tomorrow across the state. There'll be several thousand more pieces of equipment that will be coming in the near future, in the next weeks, that we'll be able to get across the state of Missouri. So we're going to be in good shape in that once we get that, start that distribution side of it. Today, I signed another executive order, 20-04, and it gives the departments the direction and authority to waive or suspend state statutes or regulations in response to the public health and public safety. It is a wide order that I signed today, and it's basically designed towards anything that we can do to help with the coronavirus. It will deal with all things such as transportation, how we get product here into the state, how do we make deliveries, and whatever resources we have, we want to be able to utilize that. It expands telemedicine. Telemedicine will be able to do some of that without some of the regulatory burden that we have. We'll also be looking at things like child care. Seen a lot of schools shut down in the state of Missouri. Now the problem becomes how we're dealing with the children in daycares across the state. And we can be able to waive some of those regulations to be able to do that. I want to say on the small business side, Director Dixon is here today. There's been a lot of questions on the Small Business Administration and federal regulations to activate the disaster loans for small business. That will happen. That's just in the process right now of getting it done through the bureaucracy side of it. So that will happen in the near future, and we'll be able to deliver that to the small businesses. The other thing that we had a conversation today with the major utility companies, and they have all agreed to not do any disconnects at this point from around the state of Missouri. Also on Executive Order 0203 today is when I moved the elections from the local levels, moving them from April to June. The idea of that is one, simply for the safety of the public out there, and two, just to delay that election. I think that's important for people to know that we didn't cancel it. We delayed that election to do that. I think a lot of things have happened today, and as I've told you before, there will continue to be a lot of things that will happen with the coronavirus on a daily basis. Things will change every day. I will go back, and I'm going to finish tonight when I finish speaking here at this podium after the other people have spoke for a little bit, but it is going to go back to personal responsibility. Social distance. You're going to hear that and hear it again. But if the people of Missouri want to protect themselves and protect their families and their loved ones, it'll be through social distancing and using common sense and taking on personal responsibilities. Those have to take place for us to beat the coronavirus. For us to get the advantage, to be able to put an end to it, it will be up to the individuals of this state. We see in other countries, when they do this, it's starting to happen. It's starting to have positive results. We just need to make sure Missouri is prepared for that and people are willing to do that. With that, I'm going to ask Director Dixon to come up just a minute and speak a little bit of things on the small business. Director Dixon.
Thank you, Governor. My name is Rob Dixon. I'm the director of the Missouri Department of Economic Development. Yesterday, Governor Parson directed the Missouri Department of Public Safety and the State Emergency Management Agency and the Missouri Department of Economic Development to work with the U.S. Small Business Administration to apply for the statewide status for every small business and nonprofit in the state of Missouri to be eligible to apply for small business disaster loans. That letter, that request went to the federal government yesterday, and we are awaiting that decision, that approval of the governor's declaration to come back to the state of Missouri. We expect that imminently. What that would do would be allow small business loans, primarily for businesses that have a difficult time obtaining finance from a traditional lending source, to utilize this program to help them through these difficult times. For a business, for a for-profit business, it would allow for an up to $2 million loan at a 3.75% interest rate. For a nonprofit organization, it would allow for up to a $2 million loan for a 2.75% interest rate. Those are 30-year loans. There will be more information and more details coming on this over the next couple of days as soon as we get that declaration from the Small Business Administration And as soon as we do that, rest assured that we will be blanketing the state with that information. We also have a variety of other resources for businesses that are available on the state's website, the Department of Health's website. There are some links on there for business and community resources as well. The other things we're doing to assist businesses right now is working with all the communities and all the economic development agencies across Missouri. We've been doing this over the last week, really reaching out to our state's employers, large and small, to identify challenges, problems, issues that they're facing, and trying to solve them where we can. And if we can't solve them immediately, to make sure that we are working on that right now with our state and federal and local partners, and we're going to be doing that as well. We've also been working diligently to connect our state emergency management and health agencies with private sector resources, and I just want to thank so many leaders in the private sector and the business community of Missouri for their willingness to step up, for their willingness to serve, and we are working with them on a variety of issues, including logistics, facilities, and things like that. They're going to be needed across the state. So want to, again, recommend folks find some more additional resources on the state's health website, health.mo.gov, and you'll find links, of course, for business resources. And again, tomorrow or later this week, we will be publishing that information on the small business program as soon as we get that approval from the federal government. Thank you.
Just want to touch on the PPE, the personal protective equipment. Certainly our hearts are saddened for the family in Boone County that lost a loved one today to COVID-19. In this case is a reminder of all of us of the importance of being vigilant, doing all that we can to keep ourselves safe, keep ourselves healthy, and to get the vitally important equipment to our first responders. In this case, the patient's family notified 911 when they called that the patient was positive for COVID-19. The 911 communications personnel got the word to the first responders, who donned personal protective equipment. At the hospital, 6 emergency responders were isolated, and they are now being quarantined as a precaution. The length of that quarantine is still to be determined. This is just one example of how important it is to take the proper steps to communicate and to have the proper equipment. Public safety and the State Emergency Management Agency are working to get hundreds of thousands of PPE pieces, whether those are masks, gowns, and other protective equipment, to our local law enforcement and fire service responders. We expect the first orders of that to arrive March 24th, and we're already making plans to distribute those pieces to our partners. We are taking actions tomorrow to respond to requests from hospitals as well as EMS facilities for personal protective equipment. That will come from the Strategic National Stockpile and will be shipped tomorrow to those requests that we have. Last week, we reported COVID-19 patient in Golden Valley Hospital in Clinton, Missouri, that had tested positive. That led to quarantining of some medical staff as a precaution, and SEMA's Disaster Medical Assistance Team has deployed there to assist medical personnel. We have provided critical care medics, respiratory therapists, a physician, and a nurse, all to assist at Golden Valley Hospital in Clinton, Missouri. The DMAT team is vitally important as a state resource to help our partners throughout Missouri. The Missouri National Guard is a proven asset and is prepared to support Missourians across the state. They are standing by for missions that will help expedite care and resources to our partners. Thank you.
We're going to go ahead and we're going to open this up for questions. Kelly, for a little bit.
Governor Parson, the Boone County resident was at home self-isolating when they became very ill and had to go to the hospital and die. What is the guidance the state is giving local healthcare providers on when to keep patients in the hospital if they're tested for COVID-19 and when to let them go?
Right. Well, those are medical decisions. I'll let Dr. Williams talk about that. But I think in reference to the Boone County, there's going to be more information released from that from the mayor's office that has more details about that, seeing how that come in early today. So I'm going to kind of go to his guidance on that, what he have. But I think he'll be able to answer those questions for him. But Dr. Williams, you want to address that briefly?
I think, as the governor said, that is a clinical decision made by the patient's provider, and the option always is to admit the patient if that's felt to be needed, or to self-isolate them at home.
Have you given any
I,
guidance?
I think one of the things that's important to note that we are still talking about elderly people in the state of Missouri, that this has a huge effect on it. I think the majority of all these positive cases have been travel related. And that is huge for the public to understand that. And what it really means when we talk about trying to get people to stay at home if you don't need to go places. What it means to reach out to your family, encourage the same things. What it means when you go to church, that maybe you don't go to church and you take care of yourself, your loved ones, and your family. It is important to follow those instructions for every one of us so we all keep each other safe, even for the people that would be exposed. It's important that they do what they're told to do, and it's important we do what we are to protect the people.
Governor, last night you said that you didn't have any intention of closing any bars or restaurants or issuing any statewide declaration of closed schools. With the increase in cases and now the first death, are you rethinking that at all?
We're rethinking things every day. I think this changes so much every day. You know, one of the things we're encouraging social distancing. We got to be able to have a plan in place, and we will have a plan in place in the near future of how we're going to deal with things, such as daycare, such as delivering meals. And there's so many differences between the urban areas, whether it's a Kansas City or a St. Louis or a Columbia, when you look at what the services they have to offer to their citizens versus rural Missouri. All of those things come with each set of complications to it. And I think it's always important to remember, when we have a disaster is what we know as disasters, whether that was the tornadoes and the floods we just recently went through. Those are normally isolated to a certain parts of the state. We know kind of when it started and we kind of know when it ended. This coronavirus is statewide every day. So things have to be looked at every day. You have to understand that things change daily through the governor's office, through the decisions we make. So I don't know that anything's hard and concrete of decisions we make. Tomorrow we may very well make different decisions, but we will try to have a plan in place to figure out how we're going to do this social distancing, because I think that is the key for everyone.
Are local officials really equipped to make these decisions? Some of these small town mayors, I mean, things like unemployment insurance, that can't be talked about at a local level, and it has to be coming from you.
Right. Well, you know, we're going to look at all the policies we have. We're working tonight. The cabinet's going to be in here. A lot of cabinet members will be in here tonight after this. We're going to be discussing those very things. Look, we're well aware that thousands and thousands of Missourians are going to lose their job, and they're losing as we speak tonight. And we got to be prepared to see how to do that. Plus, we got to try to figure out how can we keep the businesses there, if at all possible. What can we do? I think from the federal level, when they pass that federal package, there's going to be a lot of unknowns to that yet. But I do believe they're going to do a stimulus package. I think that's coming. But how that's all going to go for our small businesses and our people that are employed, and just people's going to be losing jobs. I mean, we're working on that daily, constantly, to make sure that we're doing everything we can on the regulatory environment. I think that's why we did the executive order today and why it was so broad, that we can be able to waive certain things for the businesses and for individuals in Missouri. Because right now, my job as a governor is to make sure the people of this state are safe and they keep their health. I mean, those are the two priorities right now at the governor's office.
How many tests can the state lab process per day? How many tests does it have?
Quinn?
At maximum capacity, we could probably do about 160 a day. We're doing right now at about 60 to 70 a day. We continue to get more equipment from the CDC, more reagents. So as of today, we have ample to go for about 3 more weeks, and we fully expect to have more supplied during that time.
So do we have 2,000 tests?
No. The number changes depending on how many tests we do today, but the last time I checked with Bill, we had about a 2.5 week supply. Around 40 to 50 a day.
And then how the capacity was mentioned yesterday,
Mm-hmm.
that we were hoping to process 10,000 per week.
Mm-hmm.
How are we going to get from here today?
Well, again, when we look at, WASH U has come online, University of Missouri came online today. We have LabCorp and Quest and a lab in Lee Summit. So what you're rapidly going to see is we're going to stop reporting out how many tests we do a day, because it's really becoming less relevant. because we have all these commercial labs that are doing lab tests. I talked to Springfield today. They did 80 tests a day in their mobile clinic through LabCorp. So you can see that the ability to ramp up labs testing is already started. They certainly couldn't have done that a week or two ago. And we're still hopeful by April 1st that we will be able, I don't think we'll need 10,000. By that time, flu season should be winding down by about, usually in Missouri, by about the third week in April. So very rapidly, we're going to get to a place where if you have a temperature of 100.4 and a fever, you probably either have pneumonia or you need to be really thinking about COVID-19. When we get to that point, we feel we have enough tests throughout the state of Missouri to cover it.
Dr. Williams, I'm sorry, I published this somewhere already. How many, in this moment right now, confirmed positive cases of COVID-19 are there in the state of Missouri?
At this very moment, there are 24. And again, we're going to move forward. We're going to update it every day at 8 and 8 p.m. And the reason that is that in the past for you, all we had to do was wait for the state lab to report out at about 4:30, where they call me every day with the positives. But as you know now, this is a reportable disease in Missouri. So we're getting positives. We got some from WashU already. We're getting them from other labs. So to give you one static number is probably not the most accurate information. So what we do want to do today is from going forward at 8 a.m. and 8 p.m., we'll update those numbers.
Do you have the status? The last time I saw was 17 cases. Do you have information on the additional 7 cases?
I do not. They are still being notified by the counties, but we did have positives today, and you'll hear more from the local counties about that this evening, I suspect.
Dr. Parson said that a majority of the, this might be quick for you, you said that a majority of the cases are travel related. Do you know how many are believed to be community related cases?
Up until today, the cases have been either contact or travel related, meaning maybe not out of the country, but from Florida or other places where you could clearly see that the contacts made us lead to come to the impression that it occurred out of state. On the tests that came back today, we haven't done that epidemiological workup yet, so I wouldn't want to speak to that yet. There may be that at some point, it would not be unreasonable to assume we're going to have a community transmission where nobody has a logical reason to have gotten it out of state. And that may be true for the ones that came back positive today. That's why we do our epidemiological investigation.
Dr. Carson, you actually mentioned the one Henry County case in Golden Valley. You mentioned that you were sending therapists and other resources there. Why to that case in particular?
That was where we received the request for the disaster medical assistance team.
I think one thing to finish up on the questions that you asked on that, these numbers are going to change drastically and they're going to change daily. And I think all of that information, as we learn them of a daytime, where those people came from, where they've traveled to, is something we're very concerned with, and we're going to be working on that every day. The one thing I do want you to know, all of you to know that we will be as transparent as possible on that, because we want the general public to know what that situation is. So I think it's always important. I think it's really important to know that these numbers are going to go up. Every day we're boosting those numbers to test, those numbers are going to continue to go up.
So this may be a question for you or Dr. Williams, but you mentioned you're going to increase mobile testing units. Are there going to be specific parameters for people to be able to get those tests? There have been complaints that people want to get tested, but they haven't been able to get them.
Yeah, there'll be a process in place to be able to do that, whatever we decide those guidelines are, and whatever those medical facilities do that. But again, what I said earlier, you're going to have some in Kansas City, St. Louis, it's going to be run maybe by Mercy. There's going to be some in Springfield that's maybe run by Cox. All of them will have those standards. I think you're going to be looking basically at that. The fever is going to be a big factor in that, and then the lower respiratory. I think those are the two things that's going to be a huge factor on that. So as we go by, you're going to see more and more people be tested. I do believe it. Dr. Williams, would that be you or the testing facility?
Yeah. As Governor Parson said, our goal is to rapidly move to surveillance. We think that and social distancing, if you look at China and other countries, Singapore, as you know, China is now showing a diminution in their cases. As the governor said, it's social distancing and identifying people as soon as they have that fever and a cough, just those two criteria, and getting them tested. And as I said before, once you get into about the second week of April, that's going to be a much smaller pool. The state, for our lab, will always have more stringent criteria because we need to make sure, to Jack's point earlier, that we always have a reserve so we don't run out like some other states have. But we also have the ability to contract with others. And just like down in Springfield right now, they're working with LabCorp. And so, the University of Missouri, WashU, others are certainly available. Others are coming online. So for those, we might have different criteria for our, and probably will, for our mobile sites than we would for the ones sent under the person under investigation form.
Let me make one more. Okay, we'll take one more question. Okay, all right.
You mentioned that the parts of your cabinet are going to meet tonight. What is the first thing that's going to be discussed? What's on the agenda of that meeting? What's the first priority?
Yeah, I think anytime we're looking, one, at the health care side of it, what are we going to be able to do? What services are we going to provide? We'll have a discussion about businesses. We'll have a discussion about people losing their jobs. On that, we'll continue to say, what do we focus on? How do we speed the process up with the executive order that frees us to get to a lot of regulatory environment to be able to say, what can we get out of the way? Whether that's just simply the form process or how do we get the services out there quicker? All of that tonight will be in that cabinet meeting to be discussed, those things with a lot of cabinet members here. To get with General Compton to be a perfect example, I need to know what that readiness status is for our guard. He knows that, but tonight we'll be getting briefed on that to know exactly what would happen if I give that call to get those things set up.
Okay, we got one last question from Brian.
Governor, you mentioned Poplar today. I was monitoring that just a moment ago. Thousands of jobs are going to be lost across the state. Do you have any indication you'll have to tap into the rainy day fund time in with that for either you or Director Dixon? Do you know the status of the auto plants in Wentzville and Claycoma? Are they going to shut down?
I will let Director Dixon, we were just talking about that before we come out here, but let me talk about the rainy day fund. It's one of the things we done when I first become governor, and so thankful I did that at the time when I come there, when we put the 100 million in there, and we were doing that partly for the flooding, but to have that there along with other funding, I know I've been working with the legislators every day. I am not worried about the funding source of it right now, to be right honest about it. I believe we will have the money and we'll put the money whatever it needs. It's going to be tremendously expensive to get through this next year or two, however long it might be. But I think it is so important that first and foremost is the public health and the public safety. Whatever it takes to get that done, that's what we're going to focus on. And those will be the priorities of those cabinet meetings. So we're doing that. And I'll let Director Dixon discuss the general order.
Thanks for your question, Brian. So obviously in Wentzville, we have the General Motors plant, and in the Kansas City region, we have Ford plant in Claycomo, as well as suppliers all across the state. Obviously, the automotive industry is a key industry for our entire state. Earlier today, basically the big three American auto companies came to terms with the United Auto Workers Union, and they published some information about how they're going to be handling this for their workers. I believe it has been publicly released by the big three as well as the UAW, but essentially they will be looking at sending their employees home as well over the next few weeks to make sure that they're safe as well. Thank you.
I think, let me just say, in finishing up here, I also think it's important what the media does. And if there's ever a time to make sure we're giving people the right information and encouraging them to do the things, some social distancing, for how they need to conduct themselves when they stay at home. And everyone should stay at home. If you don't need to be out right now, you should be staying at home on that. I think that's an important message that we can all deliver out there. And it comes down to personal responsibility. We can make all the laws that you want to make, but at the end of the day, this virus will be on the conduct of the Missouri citizens. What are they willing to take upon themselves? What are they willing to make a difference on? Those are what's important. What we can't do is live in a society of fear. We cannot do that. Concern, yes. Fear, not. We've got to get through this. We're going to get through this. That's what's important. That's what's important for every one of us Missourians. And it doesn't matter to me whether you live under a bridge or you live in a castle. Every Missourian is going to get treated with everything that we can have on the table to protect them, their health, and their safety. That will be the priority of this. At the end of the day, it comes down to common sense is what it comes down to. And people are going to have to understand this is a serious situation. It's not going to go away in a week or two. So you better have a plan in place, your own individuals, your families, to know that this is going to go on for sure for a month or two, I think on the short side of it. We have to prepare each and every one of us for that. And I think Missourians will do that because I think they will understand the significance of what we're doing. So thank you all for being here tonight. Thank you.